Hey folks, welcome to Transplant Helper again today. My name is Jim Merle, and today I'm going to be answering a question I actually saw the other day over on one of the Facebook posts, one of the transplant groups I'm a member of, and it basically begged to answer to the question of what is CMV and is it contagious to other people in my household. Now basically CMV in itself, it's a pretty complicated little virus you can pick up on. It basically comes down to symptomatically presenting itself such as things like fever, sore throat, swollen glands, extreme fatigue. If not treated, it can actually lead you toward having hepatitis C, just a lot of different problems with your liver, your kidneys. You can turn into a mess if you end up developing what I would call full-blown CMV. Now, typically for us as transplant patients, either we're born with it, about 80% of Americans are actually born with it, it just never presents itself, or we may contract it through our donor organ, whether that's heart, lung, liver, kidney, pancreas, whatever. It's possible that once that organ is transplanted into you, if you were not already CMV positive, you may actually receive the virus from your donor, and if that occurs, and they generally know that ahead of time, if they see that there's a CMV positive donor and a negative recipient such as yourself, they'll oftentimes put you on a drug basically called Valcite. Now that's an antiviral type of drug. It basically works really well as far as keeping at bay the CMV or cytomegalovirus, okay? So it's a pretty good drug. Now the treatment for CMV is much the same. That is, if later after, you go through that round or two, sometimes it's 3 months, 6 months, up to a year of taking that Valcite drug, if you begin to then develop symptoms of CMV, which again can be definitely hard to deal with, but if you begin to develop symptoms, the treatment for it might be to bring you into the hospital for a few days, put a few IV meds in you, get things balanced out, get you feeling better, and then in turn put you back on Valcite for yet another round. And that might, again, might be 3, 6 months, a year. I know when I had CMV, I was about a year and a half post-transplant, had a positive donor, me being negative, got CMV from the donor organ, from the heart, then in turn was put on the Valcite through the year, came off of it, seemed to be hunky-dory, seemed to be fine, ended up developing the symptoms and going back on it again. So it's just kind of a cycle, something that you always have to kind of keep your attention to, make sure your doctors are really watching after, and you can be fine. Now, the real question then comes up, and it's the one that was on Facebook a little while ago. Someone asked, if I've been diagnosed or tested positive for CMV, how contagious is that to the other people in my household? Should I be worried about them? The answer to that in general is both yes and no, okay? Yes, cytomegalovirus, CMV, is extremely contagious. It can be passed through basically any bodily fluid. So, even like kissing a baby on the forehead, that type of thing, can actually pass the virus on to them. However, most people, and I say that again, the majority or most people never develop symptoms to this. They may be a carrier of it. They may have the virus inside of them, like we do other viruses and bugs sometimes, but they never become symptomatic. So even though it's very contagious and could be passed from you potentially onto a family member in the household, they may never actually, take on to being positively tested for it, and especially never actually become symptomatic. And that basically comes down to one fact, and that is the strength of their immune system. Now, our immune systems, as you well know, are suppressed with intention and with purpose, are suppressed post-transplant because they're suppressing the system to try to prevent organ rejection. That's definitely a great thing. However, you and I become more susceptible to catching basically anything, colds, flus, viruses, anything of the sort. We become more susceptible. And because of our weakened immune system, we are then susceptible to contracting and developing symptomatic CMV. The same applies to everyone in your household. If you've got a normal, healthy, say teenage adult child or teenager or adult in your house, generally speaking, you may have CMV. They don't have any worries. It's contagious, yes, but they don't have any worries because their immune system is going to keep it at bay within itself. Probably never going to be a problem. However, if you have a very small child, an infant in your house, and or an older, a senior adult, maybe somebody 65 or older, I don't know where you really measure that, but someone who's older, both of those cases, whether it be the infant or the older adult, their immune systems can be made much lower as well. Therefore, the contagiousness of you becomes a danger to them because they could contract it. They could become symptomatic. So in a nutshell, if I were living in a household, and I do, with smaller children, if I were to be testing positive for CMV again tomorrow, I would take extreme precaution around those children, staying out of their face, just trying to stay clear, trying in some cases, to maybe mask up or, just protect that outsider, protect that child or that older elderly person. That's going to be your best bet. Now, again, you are dealing with this because of your immune system being low. Most people will never have to deal with it. Most people will never become symptomatic. So the question, yes, it's contagious, but really, it's not that much of a risk for most people. Great question. I hope this clarifies a few things for you. Just don't panic. There are some cases where you may need to go in and see your doctor and ask them questions. That's probably the best way, or maybe to have that person that may be exposed to you, ask their doctor about it. But overall, probably not a big thing, nothing to really sweat. Thank you so much for joining me today. I'm going to be putting some videos up here on one side or the other of me that you can check out here in just a moment. You'll also see a circle hovering around somewhere. Go ahead and click that to subscribe. I promise you I will do my best to continue to provide you with content which I hope will help to advocate, educate, and motivate you as a transplant patient. Thank you so much today, and all of you, please stay stronger, friends.